Overdentures are a very, very important phase of dentistry today. There are a lot of people out there, especially with lower dentures, who've lost a lot of their bone, and they're trying to wear a denture, and the denture will not stay down. They have constant sore spots, they can't eat, their nutrition is poor. The self-esteem is pretty much not that great because their lower teeth are flopping around in their mouth. Overdentures are very, very important. What an overdenture basically is, it's a denture that actually attaches to something in the mouth, so the denture will stay down. It doesn't come up, okay? It will be fixed into place. And originally these were supported by remnants of teeth. There'd be teeth left, and we put attachments into the teeth and then make the overdenture to stay in. But with the advent of implants, we have a much better way of doing this. Generally now, with most overdentures, what I would recommend is the patient to have some implants placed in their mouth, and then we basically add an attachment onto the implant, an attachment into the denture, and then the denture just snaps down and locks onto those attachments, and now the patient has a fixed type of appliance that they can eat on. It's not going to come bouncing out of their mouth, and it's all the difference in the world. They're comfortable. It improves their self-esteem. It improves their nutrition, and it's just a win-win all around. And overall, not horribly expensive, and it's just a tremendous benefit for these patients who've really been suffering with an ill-fitting lower denture due to loss of the bone in their mouth. It really can be a tremendous help. There are two types of overdentures out there, and basically what's placed are these little, they're called mini implants, are placed in the bone, and they can get some retention right away from them. The problem with these types of implants is they really are not long-lasting. It's not really a permanent solution. It does give them an immediate benefit, but as far as for the long term, those will eventually fail. A better treatment option is to have some standard implants placed that will integrate and probably be in there if they're taken care of properly and maintained, generally for the life of the patient. And that's, in my opinion, is really the way to go for the long term. And generally, depending on the patient and the bone and what needs to be done to get the implants in there, usually once the implants are placed, it's usually 2 to 3 months before we can actually attach to the implants. If the patient needs a graft, it could be longer. So again, it really has to be looked at on a case-by-case basis as far as how long it takes to get treated for something like this. It can be a matter of a few months to up to 6 months, depending on the patient's unique situation. If any patient who is suffering from an ill-fitting denture wants more information about overdenture dentistry, pick up the phone and give our office a call. We'll offer you a complimentary consultation. We'll evaluate your situation and offer you a treatment plan that's going to be best suited for your personal problem.